COVID-19 has a huge impact on the fight against HIV, tuberculosis and malaria. It increases already existing inequalities and puts a high burden on communities and key populations. The world was not on track to fight the three diseases before COVID-19. However, its impact should not reverse what has been achieved within the last decades. We need a strong and fully funded global fund based on human rights principles. What we certainly don't need is a fragmented and weakened global health system based on security concerns.
We learned a lot from our interview partners. Let's apply their lessons.
Thank you.
Hi, my name is Joyce Ouma. I am a 24-year-old living openly with HIV from Kenya, and I am a member of the Global Fund Advocates Network Speakers Bureau, and I represent adolescents and young people in various platforms, including the community's delegation to the board of the Global Fund and the Kenya Country Coordinating Mechanism. And I also work with the Global Network of Young People Living with HIV as the Influence and Engagement Advisor.
What's motivating you?
So as a young woman living with HIV, I have always had the desire to control how things are working for people and for young women living with HIV in general. It was as a result of the inequities that we face. And also my main motivation to start this work was the stigma that I got exposed to. A few years back when I was just newly diagnosed, I was exposed to a couple of stigma sections. I lost a couple of my friends, and that is when the reality of living with HIV really started to hit me. And also having to take a pill every day, it's never easy. So I got into this field because I wanted to support other young women living with HIV like me to be able to adhere to their treatment, and also for them to be able to have the highest quality of health that there is, or that the governments and the communities can offer. So basically that was my desire, to tell people that HIV is normal. It doesn't make us any different. We still are recording very high cases of new HIV infections, new TB infections, and new malaria cases, especially because of the climate on this side. The situation has always been bad, but with the Global Fund coming in, it's easier now to come from those particular areas, because for those who come from malaria endemic regions, we have the Global Fund supporting initiatives such as the mosquito nets. And you find that almost each family in those regions now can sleep inside a mosquito net, and hence avoiding malaria cases. We also have TB. The Global Fund has also invested largely in TB, the gene expert machines, and TB medication for TB patients. And it has also looked into the correlation between HIV and TB as well, the integration. And now for HIV, which I am afraid I'll be mostly biased to, the Global Fund has ensured that we have medicine. I mean, ever since I started taking my medication, I have never lacked medication for even a single day, because the Global Fund has ensured that we have enough, of course, alongside other partners. We have HIV prevention interventions. We have condoms being distributed. We have social behavioral interventions that are also being put in place, especially for the adolescents and young people, so as to curb the HIV, to curb HIV infections. So I think the Global Fund has really tried to slow down the epidemics. And as we can see from the recent reports, that the Global Fund has saved many lives. So Kenya is one of the countries that contributes, and I am one of the people that contribute to that number that shows the huge success. And of course, COVID-19 impeded some of this growth. And for the very first time, I think the Global Fund recorded some not as much progress as they usually do, but the Global Fund has made life a bit better for us, because I can only imagine if it was my government that is supposed to cater for that medication that I take daily, if it's my government that is supposed to cater for my psychosocial support and well-being, I can only imagine where I would be right now.
What are the most important key principles of the Global Fund to you and to the work that you're doing? Can you add some thoughts on that?
at the CCM level and as a community representative, I have seen the Global Fund processes being transparent from the beginning, from the writing process to the grant making process. All through it was engaging community. Also the aspect of community engagement. I always take pride in the fact that adolescent girls and young women, and especially adolescent girls and young women living with HIV, are at the center of Global Fund's programming. We have seen the Global Fund having new initiatives such as Her Voice Fund initiative, which provides funding for youth organizations at the community level. This is happening in over 13 countries in sub-Saharan Africa. And to me, it's a huge step, because the Global Fund is the first global funding institution that I know that has put so much trust in young women and the belief that young women organizations are capable and have the capacity to implement and actively engage in policy. I think the other thing that has really affected, that COVID has brought to light, that has affected me as an individual and other young women and young people living with HIV, is the correlation between COVID-19 and HIV. I think COVID-19 has brought to light, one, the fractures that have been existing in our community for a very long time. It has exposed, of course, everyone is now blaming COVID-19 for poor service delivery, but that has always been the case, except. So one thing that we learned from HIV movement is the stigmatization of a disease or of an epidemic from the beginning. When COVID-19 just came in, there was a lot of stigma towards towards people who had suffered COVID-19. And even from the way the government reacted to people who had fallen ill with COVID-19, it's already brought in a very familiar situation with the current stigma that we are trying to fight off as a movement. The other lesson that COVID-19 has brought is we need to have resilient health systems and structures. COVID-19 took the whole world by surprise, and we had to rush to make tents. Like in my country, we had to rush to make tents with some poorly made hospital beds because it's an emergency. But these are not sustainable. Most of the people living with HIV do not have insurance covers, probably because some insurance companies in their policies do not insure people with pre-existing conditions, or the price goes higher because HIV is determined as a pre-existing condition. So we still have countries that are getting funded by the Global Fund, but really criminalize key population. And this continues to impede the growth or to impede the success that we've had so far. So I'm thinking whatever model that the Global Fund needs to adopt, it has to be an all-inclusive model that caters for everyone in all their diversity, especially the marginalized and the stigmatized populations. So I think for me, a global health champion is one, a face, a leader, a supporter. Two, of course, we are talking funding. So the Global Fund needs funding, and other global health institutions also need funding to continue doing the critical work and the crucial work that they do. And in terms of funding, I think it's also quite critical. We, as communities, we've been calling for a separate funding stream for us as communities, because we also do essential work that complement the work that is being done by our governments. So if Germany can be a strong proposer of that, just in general, I think that would be what a global health champion to me would look like. So I think we all have one mission, and that one mission is to eliminate HIV, TB, malaria, and now COVID-19. And that means leaving no stone unturned. And that means that we have been doing things one way. We have been working with government. We've been funding government for the longest time, governments, and we're leaving out civil society because we keep saying civil society do not have the capacity. And I think now it's time to do things differently, that civil society have been building their capacity for the past more than 10 years, because the Global Fund has been in existence for 20. And the Global Fund has also embraced the dual track financing, which sadly is sounding really perfect on paper, but when it comes to the country level, during the grant making processes and during the funding request period, the government takes the hugest chunk of these particular resources. So I think my argument would be it is time to do things differently, and communities are very capable. Communities have the evidence, and we have done our own forms of research, and we know we have lived through it, so we know exactly what works and how.